It's time with the Ivy Rehab Injury Report. Ivy Rehab Physical Therapy Centers with over 18 locations in South Jersey offering best-in-class outpatient physical therapy. Dr. Josh Lamb is back with us for another edition of the Ivy Rehab Injury Report here on Hanging with Hennig on 97.3 ESPN. Dr. Josh, how you doing today?
I'm doing great, Josh. Thanks for having me back. It's nice to be here to talk about some sports injuries and kind of what's going on in the world of the Sixers.
Well, the Sixers seem to never fail us because they seem to have a new injury, seems like every week. And this week now it's two new injuries. So I want to start with the Tyrese Maxey thing. I think that's the one people are the most confused about, right? So for those who don't know, Tyrese Maxey has been
Yeah.
diagnosed with a tendon injury in the pinky finger of his right hand. Now, he is scheduled to be reevaluated in 3 weeks, but we know it doesn't mean he's coming back in 3 weeks. It just means being reevaluated. So when someone walks into Ivy Rehab and says, I injured the ligament in my pinky finger, what is going through your mind, Dr. Josh?
So I'm going to be thinking about exactly what that could mean as far as the hand is a pretty complex mechanism. There's a lot of moving parts. There's a lot of joints. There's a lot of tendons. There's a lot of ligaments. So now when they did his evaluation, they initially did an x-ray to rule out any sign of joint injury, fracture, anything like that in the bones. And that was ruled out as a differential diagnosis. So they then performed an MRI to try to really look a little bit deeper into what the source of the injury was. And that's where they diagnosed it as the tendon injury. Now, a tendon is a connective tissue. It's a band of connective tissue that connects between a muscle and a bone. It's what allows the muscle to pull on the bone, creating movement at the joint. So when a tendon is injured, it's that connection point between the muscle and the bone. It can typically be broken down into 3 grades of a tendon injury, which was what we call a strain injury. Muscle or tendon injuries are what we call strain injuries, as opposed to a sprain, which is a ligament injury, which we can talk about a little bit later. But the 3 grades of strain injuries, grade 1, grade 2, and grade 3. Grade 1 is going to be what we would look at for microscopic tearing, very small tears, but still can be very, very painful. Typically, we're going to be able to have a very strong but painful contraction with a grade 1 sprain or strain. So that's one of the mechanical things that we look for with our tests and measures. Grade 2 would be a larger grade tear, something that would be visible on imaging, such as an MRI. Typically is associated with very weak contraction and extreme pain with contraction, often associated with significant bruising as well. Whereas a grade 3 would be a complete tear. That tendon or that muscle is completely torn. That's going to need surgery. When we're doing our mechanical tests for that one, we're typically going to expect to see extreme weakness and almost pain-free contraction because it's torn completely. It's not pulling on anything. There's no tear for it to pull on anymore. It's been completely ruptured. So that's a very interesting finding. Now, with Tyrese Maxey, they're looking more at a grade 1 strain, it's looking like, of one of the tendons of the pinky finger. Sounds kind of interesting when you think, oh, it's just the pinky. What could that be a big deal? But that's going to play a huge role in his ability to control the ball, to grip. It's going to be painful if it's jarred or jammed or pulled on again. So they're going to be looking at making sure that that tendon is protected and well along and healing before he goes back to sport, as that will significantly impact and hinder his ability to perform and increase the risk of it progressing to a higher grade strain injury, which could be much more long-term in recovery. They did look at a potential 3-week reevaluation for this strain, which would be typical of a grade 1. Oftentimes, we're looking at about a month for recovery, and that would put us into what it would be progressing through the 3 stages of healing: inflammation, proliferation, and maturation phases of healing. That would have gotten him through the 2nd stage into the maturing phase, where it's laid down enough strength, enough connective tissue, enough scar tissue to hold itself in place and to be able to start reapplying to play. But we would definitely be looking at protecting that tendon as he goes back into play, potentially with taping, potentially with bracing, because the last thing that they would want is for that tendon to be forcefully pulled or forcefully contracted again to the point of returning to injury or even worse injury.
Now, that was the other part of what I want to ask you about. Again, Dr. Josh Lamb from Ivy Rehab Physical Therapy Center with over 18 locations here in South Jersey. This is an injury he has had previously. So What is the kind of the thought process for you to have someone who walks in, let's say to Ivy Rehab, and say, hey, I have an injury and I had this injury before as well? What is maybe the impact of that part too?
It's a very interesting question because when it comes to connective tissue injuries in general, whether it's a ligament or a tendon, there can be an increased risk of it re-injuring with each subsequent injury that occurs. And the reason for that is because it can elongate or overstretch the connective tissue, weakening it over time, increasing the risk of it injuring. And in the hand in particular, with all the different moving parts, that some of the tendons of the fingers actually kind of cross over each other. One dives through one of the other ones. And if those tendons enlarge or thicken or swell excessively, they can start getting caught up on each other, something we call trigger finger. And that's something that we would definitely want to avoid in a basketball player that could significantly impair performance. So that may be an indication for them delaying his recovery longer than maybe that otherwise would be thought, because the more often this happens, the more likely it is to happen again and the worse it can become. So protection, bracing, taping, if they are going to get him back into play as soon as possible, which with the season, well maturing into its later stages, they may want to get him back, but they're going to want to be very careful that they try to avoid this from happening again.
Let's get to the other Sixer as well. I think the Kelly Oubre injury is also very interesting. Dr. Josh Lamb joining us from Ivy Rehab Physical Therapy. So he suffered what they're calling a sprain of the lateral collateral ligament, the LCL, in his left elbow. Now, again, like Maxey, this is his shooting hand. So Maxey injured the right hand. That's his shooting hand. Oubre injured his left arm. That's his shooting arm. He's going to be reevaluated in 2 weeks. So for you, when you have a guy, not just the sprain of the LCL, but also talk about the relevance of that being someone's dominant hand.
Exactly. So the what we talked about before being a strain injury that's involving a muscle or a tendon, a sprain injury is a connective tissue injury of a ligament within the around a joint. A ligament is a band of connective tissue as well, similar to a tendon. However, it connects bone to bone, and that's going to help hold the joint in place. It's going to help hold the joint stable, and it's going to prevent motions that the joint isn't really intended to move in. For example, the LCL, the elbow, prevents what we call varus stress movements. It helps to prevent, when your elbow is straight, the forearm from bending inwards. The elbow is supposed to bend, forward and back, flexion, extension, we call it. It's not supposed to bend side to side. So the LCL helps stop it from bending side to side inwards. The other interesting thing about ligaments and joints in general is they help with a lot of what we call proprioception. Proprioception is our coordination of where our joints are, helps us to know how we're moving through space. And at the athletic level, this all has to happen at an instinct, moment to moment. Everything happens so quickly. So an injury to a ligament of the elbow in his shooting arm can affect his coordination and control of where his arm is in space, how he's moving that ball, and the coordination for shooting, reaching, passing can be thrown off. So that's something they're going to want to be practicing a lot as he is working towards recovery. And that's something they should be able to do fairly early on. Normal motions, especially what we call open chain motions, that's where the hand is moving freely through space, as opposed to closed chain where the hand is connected like to the ground and is like a push-up motion. When he's moving the ball, that's more of an open chain. His hand can move freely through space. There's not a lot of stress on the LCL in normal movements like that. So he should be able to practice shooting. He should be able to practice passing, dribbling, careful movements, some strength training he can start doing pretty early on without overstressing that LCL. And that will help to maintain that coordination and control while the body's working on healing that ligament.
So you just talked about strength training. So talk about if someone came into Ivy Rehab and they had an LCL sprain. Like, what is some of the things that people, you and the team at Ivy Rehab, are going to say to someone to say, here, this is what we got to do to get you back to where you were before the injury?
Yeah, absolutely. Because the motion that the LCL resists, called varus motion, there is no muscle that directly crosses the joint at that angle, because the joint simply doesn't move at that angle. It moves forward, back, the forearm rotates. Obviously, we have the wrist going up and down and in and out in all directions, but the elbow does not bend inwards. So what we need to do is strengthen all of the muscles around it. We need to strengthen the muscles that bend the elbow, the biceps, the muscles that extend the elbow, the triceps, the forearm muscles, the hand and wrist muscles attach up near the elbow, and some of them even cross the elbow, helping to build stability. So grip strength training, hand opening strength training, the muscles of the back of the forearm, opening your hand against resistance, turning your palm up and down, what we call supination, pronation, the rotation motion of the forearm. All of these motions will help to build stability and control of the elbow so that the muscles can help make up some of that difference. As I said before, with when we were talking about the tendon, the ligament is now going to be a little bit stretched out after a sprain injury, leading to a little bit more laxity, a little bit more movement than there otherwise was. And it's going to now be up to the muscles to compensate and stabilize that movement through strength training in all of those various directions, not just at the elbow, but also at the forearm and at the wrist, because they all play a role.
Before we let you go, if you were to take, anytime you have somebody who has an injury, this kind of goes for Maxey and Oubre, right? It's the idea of dominant hand versus non-dominant hand. How does that factor into someone's recovery? Do you look at it as, hey, we got to be more careful with the dominant hand or less careful with the non-dominant hand? Like, is there a different approach at all?
There is a bit of a trade-off with the dominant hand because we tend to use it more in day-to-day life with other things. So if we're needing to highly rest a tissue, we might need to be extra careful with just normal day-to-day tasks, even things as simple as, wiping a counter or carrying groceries. Fortunately, the LCL doesn't take on a lot of stress with basic movements, but a lot of rotational or bending kind of movements, like even like I said, like wiping a counter, there's going to be some side-to-side stress that goes through the elbow. So depending on the extent of the injury, you might need to be a little bit careful with that. So patient education, athlete education, letting them know, hey, let's maybe take it a little bit easy on this. You try to use your other arm for some of your daily tasks to allow a reduction of stress on that structure, that ligament, so that it can continue to work towards healing. And if anything hurts, take a break and let it work towards recovery.
He's Dr. Josh Lamb, of course. It is Ivy Rehab Physical Therapy Center with over 18 locations in South Jersey, and they are also my physical rehab center. Me, Josh Hennig, here on 97.3 ESPN. Dr. Lamb, appreciate you jumping on. Enjoy the rest of your weekend. Thanks for the insights. I'm sure I'll see you next week at the down at Gateway Courthouse.
Absolutely. Thank you so much, Josh. Have a wonderful weekend. Take care.